Hello, welcome to this edition of the Lynne Hayes Freeland Show. Well, if you've done nothing else this past week, I'm sure you have watched the coronavirus numbers and you are fully aware of the fact we're not in a good place. And you know what they say, if the community at large is not in a good place, our community in particular is not in a good place. That is exactly what we're going to focus on today. My guests today are members of representing the Black Equity Coalition. Who are they, you ask? And what is the Black Equity Coalition? We're going to learn all that this morning on the Lynne Hayes Freeland Show. Dr. Tracy Conti is the Executive Vice Chair of Family Medicine with UPMC. She's been here. She's one of these people that comes on the show. Depends on what hat she's wearing on any given day. She wears a variety of different hats. And Dr. Jamil Bey, he is also the president and CEO of Urban Kind Institute. He kind of wears a couple different hats too, but that goes to show you that they're both very much involved in the community. Welcome to you both.
Hello.
So let me first ask you, give us some insight into the Black Equity Coalition.
So we came about.
So the Black Equity Coalition.
Go ahead.
I'll let you go, Dr. Bey.
We came about in early April, just a network of folks that we grew out of another network that we, just in response to the pandemic.
Mm-hmm.
And it was we came together as a group of folks from the schools of public health at Pitt, some medical doctors, some folks who work in community and philanthropies. And we came together to sort of coordinate outreach and engagement with our communities around the COVID threat, and to make sure that the county health department was being responsive and respectful to the needs
Mm-hmm.
in the community. And so, we evolved into a much larger network as people saw that we were active and really, deliberately getting messages out, talking to folks, making sure the communities had resources, and doing a whole lot of behind the scenes coordination. And, grounded in this view of health and public health. That's where, just the importance of having doctors and public health folks on the team.
Mm-hmm. And so then, Dr. Conti, where are we? Because, I think that sadly in 2020, there used to be this old cliche, if the community got a cold, our community got the flu. And I think when we talk about the coronavirus, when we talk about COVID-19, I think that that's still true.
I agree. And it's one of the reasons the coalition came together, because we saw in other parts of the country how it was having an impact on our communities. We have said that COVID did not cause health disparities, but it certainly shined a light on them, and just highlighted the differences in the communities, really looking at, who was able to do some of the mandated restrictions, who could stay at home. And we knew that there were essential workers in our community that could not isolate. We know that it was affecting populations with diabetes and heart disease at higher rates. And we know that that happens on our communities. So again, all the things that affect communities of color, COVID really, affected those populations. And we saw that reflected in the numbers. Our population has COVID at a higher rate than other populations. And it's important that we address that and that our communities understand that.
And Dr. Bey, I think one of the things that concerns me in particular is when this whole thing started, there was a lot of discussion, a lot of concern about Black and brown people and how we were being affected. And then I feel like it's like everything else. Then the emphasis kind of shifted, not taking anything away from the elderly and, other affected communities. But all of a sudden, people weren't talking about our community anymore. They weren't talking about how we were being affected. And I feel like we kind of fell off the grid.
Well, and that's probably the way a lot of people felt too. And when we weren't getting that attention, Um, and, it's sort of like, well, maybe it's going away. We weren't taking it as seriously. We have not had this leadership on this that really has communicated the seriousness of the threat, made resources available, as Dr. Conti was saying, so that people could shelter in place, that the infrastructure for our economy, these frontline workers, these people who we depend on every day just to make the country work, they're essential. We don't value their work. We don't respect, they don't have health care often. They're not paid wages in, that where they can, sustain their family is in a sheltered place. And after a while, it's like, okay, this grind too, when you've been marginalized and excluded for so long, here's one more layer on top. And it's all right, we'll bear this too. And after a while, folks get, we're just tired of that. And people wanted to be social and want to get out and want to have a release, and against the advice of health professionals. But absent leadership that provides a solid path of hope that we can get through this. We've had political bickering, and we just haven't had leadership in the county stand up. And the state, Pennsylvania has the lowest per capita testing in the country. Of all 50 states,
Wow.
the lowest percentage of the population has been tested. And we have the highest number of excess deaths that are not COVID related. So the number of deaths that we had in Pennsylvania that you would expect to have just because people die naturally, we've had the highest number of excess deaths that have not been classified as COVID deaths in the country. And so this is like just failure from so many different levels in addressing the people's needs that have created this fatigue and this feeling of we don't count.
And now here we are. The holidays are upon us. The numbers are going up. And what does all this mean? We're going to talk about that after this commercial break. I know you don't want to miss it, so we'll be right back.